let me give you another
I get the
example. This
regret.
25-year-old Australian lady, right here in this article, woman who was suing her doctor because she was delivered vaginally and her mother had wanted a C-section. And the doctor reportedly ignored her mom's request, we don't know everything about the lawsuit, for a C-section, used forceps, and she endured a nerve injury and was left with one arm paralyzed from Erb's palsy.
Oh, yeah.
Okay? So this doctor made the decision for the mother. The mother wanted a C-section for whatever reason, whether she thought the baby was big or whatever, and the doctor went ahead and made the decision, no, you can have this vaginally, and the baby went ahead and, had an injury. And this is, this is why we as obstetricians and pediatricians, we have to have insurance for, over 18 years because things can show up later. People can, grow up and decide they want to turn around.
Statute has to last 18 years.
I have to have
You know what?
insurance.
For pediatrics,
Yes.
it goes 10 years after their
Really?
18th birthday, so actually 28 years.
Talk to us, Lisa, about your profession is one where there are states now in this country where you can't find an OB to deliver your baby.
Because the insurance is so high because, yes, people find so many different things that we're so open to liability because it is a very risky process, delivering a baby. So many things can happen that have nothing, but that's why the legal system has to show that the doctor followed all the appropriate care during everything, and yet this still happened because we can do everything right and things can still happen.
Big difference between a mistake
Yes,
Right.
and
and an
negligence.
unfavorable outcome.
Reaction, right.
In the case like this, the doctor did his best. When you do a forceps delivery, there can be complications. That's different than leaving an instrument in somebody, or
Absolutely.
Or operating on the wrong leg.
or a sponge, something like that.
Yes,
Now that
that
clearly
utter
is a
negligence
mistake.
is a
That
completely
that
different
is
game.
why we have insurance, and I think in a case like that, obviously, you should be compensated in some way. But right now, it's too easy to find a lawyer that's going to take a case for what we call just an unfavorable outcome. And that's not right. And I think that's a message that people out there have to understand, that we're trying our best, but it's an inexact science. Not everything is going to be 100%.
All right, crew, you guys see what time it is? You want to go make some TV?
Time already?
Make some TV.
All right,
Yeah.
let's go
All
do it.
right.
We'll talk about this more later.
Hey, let's
We
not
should
forget
do
to
this
show
more
a picture
often.
of these beautiful twins
Yeah.
that passed away.
We will.
Before you pass judgment on who should turn off what machines, look at the life
They do.
in these pictures,
In those
okay?
pictures, they do-
Imagine
they
you're
do
the
look for
mom
the
looking
life.
into these smiling faces. Would you say, do not resuscitate, do not save my babies? Think about it.